If you go to healthcare.gov today, and a lot of people who are watching this will be able to immediately access it, what you'll find is that it works pretty darn well.
About 84,000 residents who qualify for Medicaid have not had their applications processed because the state hasn't received them from the feds.
Florida Healthcare told me that I could not disenroll with them because I enrolled through the marketplace, so I have to disenroll through the marketplace.
The marketplace is healthcare.gov, and a couple of months ago there was no way to disenroll from your insurance on the website.
I was blown away that they had not thought forward enough to realize that people are going to disenroll. This is going to be a common practice.
Diana Wells has been trying to apply for insurance in the Washington Health Plan Finder for about a month, but keeps getting an error message.
Washington's online health insurance exchange for Obamacare is experiencing more problems with 15,000 applications that are stuck.
The next month we got a bill. And so we called them up, and they apologized and said that it had been taken care of.
Not exactly.
The month after that, we got another bill. 4
bills in total.
Maryland's online health care exchange has some significant problems that are not on track to be corrected by the March 31st deadline for open enrollment.
I had no luck here either.
Finally.
It was 3,118 attempts. I had spoken to 49 people. 3 of them I would actually trust with my order at the local McDonald's.
More than 6 weeks later, after spending 50 to 60 hours on the phone, his policy is still not canceled, and he is still waiting for the payment Florida Blue withdrew from his account to be refunded.
This is like just taking my patience right to the end, and I am on the verge of just, exploding.
You can keep your plan if you are satisfied with it. If you like the plan you have, you can keep it. If you like your health care plan, you'll be able to keep your health care plan.
In California, Kaiser Permanente terminated policies for 160,000 people. In Florida, at least 300,000 people are losing coverage.
I just want to know why I can't keep what I have. Why do I have to be forced into something else?
Their premiums have increased, their deductibles have increased, some of the things have been carved out, what was covered is no longer covered. It's been a debacle for the practice.
I'm not going to lose my house because I don't have health insurance and I need medical assistance. So I'm dead in the dirt, I can't do anything.
I just wish I could have my insurance back. That's what I want.
Well, that's a lie. It's a straight out lie. The only way you can keep it is if you have to pay a whole bunch more in premiums.
Estimates are some 2 million people won't get to keep their health insurance because it doesn't meet the minimum requirements.
I'm angry, upset.
Last month, Doug Hall's healthcare provider told him they are terminating his current plan.
Well, I basically looked at the letter and I threw it in the corner.
It's very frustrating, but it's more scary because I'm thinking I'm not covered, so if something should happen, I don't know what I do.
It's been aggravating to have to see that your policy that you were perfectly happy with doesn't exist anymore.
Having to pay more money for coverage that's not really as good for me is pretty disappointing.
Gloria Cantor has 5 brain tumors and tumors in her bones. Now they have another battle to fight, trying to keep their health insurance.
If this letter make more problems for us, then we don't need in this moment.
Deborah is battling kidney cancer.
There's a duty call.
We were happy. We had great insurance. We had continuing care for our employees.
Great until owner Betsy Atkinson learned the policy would be terminated.
My expectations were that it would actually enhance my existing health care plan.
How has it worked out for you so far?
That wasn't the case. I was notified that my plan will be ended at the end of this year in December.
My situation, the maternity and newborn care, I would absolutely never, ever use.
I look at the whole realm of things and say, what's going on? Why is it getting worse and why are we having to pay more?
This is not affordable at all. This is a very unaffordable care act. He lied to the country. He lied to me.
I never expected to be dropped by Capital Blue Cross. I just assumed that it still happened.
In the end of September, I received a notice from my small business health care plan that it was going to be terminated as of February 1.
I was not pleased when I received a letter dated September 21st
that my plan was going to be canceled.
How is this helping the average American that works 40 to 50 hours a week? How are we supposed to live?
And I'm a supporter of Obamacare, and this was part of my issue, was that I did tell everybody it would be better. But I still don't understand why, even if all those are covered, why my premium is going up $350.
My story had been shared by the president. I felt like, I just felt really embarrassed that, he had quoted my story. At least for right now, I'm not going to be getting insurance.
I am sorry that they are finding themselves in this situation based on assurances they got from me. No matter what you've heard, if you like your doctor or health care plan, you can keep it.
Actually, I had lost my doctor who saved my life, who was the reason I found the cancer when I did, which is why we're able to talk today.
I wanted to cry. I've been going there for 26 years, and I really like them and trust them and want to keep them as my doctor.
You're going to see docs my age that are kind of getting closer to retirement age just say, had enough, ready to go.
When we saw what those exchange plans were paying, the ones that we could not participate, we did not.
It broke my heart. I have to say, I've been waiting a year and a half. This is my favorite doctor.
She's one of the many doctors who've discovered they're listed as in-network on the state's health exchange, even though they're not actually accepting patients with those covered California policies.
We can't. We'll be out of business.
We're seeing a great deal of confusion and at times anger and frustration on the part of these families who bought insurance thinking that their children were going to be covered, and they've in fact found that it's a false promise.
Turns out their gold plan was not the gold standard. Horizon Blue Cross only participated with the Rosamelia's doctors on the less expensive, higher copay silver plan, something Lynn found out while Fred was nearly unconscious post-transplant.
We have health insurance at this point that is worthless.
Come to find out the other day that the insurance companies that are offering ACA plans in South Carolina are not offering the doctors and hospitals that we've been accustomed to using.
She looked at the card, she looked up on the wall, and she said, sorry, we don't take your insurance. I said, what do you mean you don't take my insurance?
When you promise the American people something, you have to stick with it. You can't say something and then change it.
They're going to have to make some choices, and they might end up having to switch doctors.
A system where we're going to work with your employers to lower your premiums by up to $2,500 per family per year.
We will start by reducing premiums by as much as $2,500 per family.
If I didn't have my family, basically, there's no way that I'd be able to afford, an extra $175 a month, which I guess is what the kind of going rate is for Obamacare for people my age.
As a pastor, Ann Grant has devoted his life to helping others, to being compassionate. He says there's no compassion in the Affordable Care Act.
I'm sitting there with stage 3 esophageal cancer. They're taking me to the finance person and saying, how are you going to pay for this?
Disability that I get $951, and the insurance that she looked over, it would be $400, and that would be something out of the $951, trying to live. I couldn't pay that.
Now, you used to pay about $52 a month, and now you're paying how much a month for health care?
$373 a month.
The deductible is gone crazy. $12,700 deductible, that's a lot of money.
$895 a month for health insurance is coming out of my pocket. That's a house payment for most people.
My deductible went from $2,500 to $6,300. And out-of-pocket cost up to $12,700. That's the difference. And I lost my prescription, and my premium doubled.
Which will increase my rate from $463 to $1,212.47.
Affordable for whom? It's basically squeezing us right out of the middle class.
It would take food out of our mouths to be able to afford these coverages.
It's sort of forcing you to walk the plank.
So now I'm definitely in a position where I'll be bankrupted if I get ill or seriously injured, where I wasn't before.
How can my premium double per month? How can our deductibles go up on every single family member? And yet you're providing me the same
plan.
We're looking at our family personally at over $2,400 a month for our premium, and our deductible went up 4 times.
If you do qualify for a tax credit, then I think a lot of people may end up being pleasantly surprised. It may end up costing as little as $50.
If your employer provides you health insurance on the job, nobody is talking about messing with that.
Hammond Memorial Hospital says 6 employees were laid off because of the adjustments they had to make from the effects of health care plans under the Affordable Care Act.
Our state will see about 300,000 full-time workers reverting to part-time status.
The hospital has not met its targets due to changes in Medicaid and Medicare reimbursement. It adds up to an estimated $10 million annual decrease in funds. There's also $27 million in free care and bad debt.
Blake would go from 79 hours every 2 weeks to 56. He lost about $300 a month in income.
We were scheduling most of our employees, part-time employees, 39 hours a week. With Obamacare and its regulations, we have to cut all those part-time employees down to 29 hours per week.
We're going to have to find that money somewhere, or plan on doing more with less on a fire scene. And I don't think any of us have that luxury to say, you know, half the people that are coming just stay home. We don't need you.
Our volunteers are here 24/7, and they're willing to risk their lives or whatever, and drop whatever they're doing to come help us.
70% of the fire service in Ohio is provided by volunteers, so it does have a significant impact on the state of Ohio, and it does have a significant impact on local communities throughout the state.
We've got a good number of subs who have come to rely on substituting as their primary source of income, and unfortunately when you cut hours, you know you're affecting their livelihood, and it's not something we want to do, but it's something that we're forced to do because of these mandates that have been put on us.
When they can only work so many hours a week, it puts even a bigger burden. If those subs, if we have to have them, they work over that, then we either have to offer them insurance or have to pay a fine, which of course, hurts us.
Recovery centers across the state got horrible news. Because of the Affordable Care Act, the state is no longer chipping in money to pay for outpatient services for the poor, and the federal payments aren't nearly enough.
One of the options was to limit subs to not working more than 28 hours a week and expanding our pool, but that's disruptive. A lot of times we have long-term subs where someone's out on maternity leave.
The district says the cost of insuring part-time employees is uncertain right now, but by not covering or offering insurance, the district could face close to $2 million in fines.
3 Kanawha County centers will be closing soon. The daycare centers are at the Capitol Complex, Shawnee, and Elk Center schools. The county says they're too expensive to operate and have been losing $65,000 since the beginning of the school year. The buildings are in major need of repairs too, and there are concerns about added costs because of the Affordable Care Act.
You might want to hear this. News 4 has confirmed that 24 Hour Fitness is closing its daycare operations. A former employee says the cuts are a result of the Affordable Care Act.
Cutting back to hiring 30 hours. We've done that. We've had to do that, and it's horrible. I hate having to do that, but it's so uncertain and you don't know what's coming.
Drop down to the level where you can afford it, which means that customer service will suffer. It means that there will not be as many employees here as I have right now.
1,000 jobs in West Michigan that would have been here absent the ACA.
A 40% increase in our health insurance may mean that we don't provide health insurance anymore, that everybody would be on their own.
Obamacare is an additional $7.1 million expense for us as a company, so we have to decide whether or not to pass that expense to employees or whether to cut other benefits.
We anticipate our cost to be increased about $250,000 to $275,000 a year with the Affordable Health Care.
We might have to look at, getting rid of 401k, and we have a great 401k program that my father put in place.
If it was about making it affordable, it certainly didn't do that for us.
The unbelievable complexity of it, the lack of transparency of it,
the horrific surprises.
There was some news that you all made about dropping benefits for 15,000 spouses of your employees. You cited that back to Obamacare.
This is the biggest deal affecting our union right now.
And I see 55,000 union members voting Republican.
There is absolutely no evidence, and every economist will tell you this, that there is any job loss related to the Affordable Care Act.
Because it gets rid of the waste and inefficiencies in our healthcare system, this will be the largest deficit reduction plan in over a decade.
The New York Times says jails and prisons around the country are enrolling inmates for health insurance under the Affordable Care Act. States can save millions by letting Medicaid pay for prisoners' hospital stays lasting more than 24 hours.
Now, for the first time, we're hearing estimates of how much more the troubled $200 million website will cost taxpayers. At a hearing in Annapolis today, state budget officials revealed an estimated $30.5 million over the next 18 months because of just one bug in the system.
It's the most expensive IT project in state history, designing and building the Cover Oregon website, initially funded with $48 million in federal grant money. That was in 2010. Fast forward 3 years, and project managers had convinced the federal government to grant an additional $172 million in taxpayer dollars. What does the state have to show for it now? A website that still has more than a dozen critical coding errors and has failed to enroll a single Oregonian in a private health insurance plan.
The good news is that in part because of the Affordable Care Act, Obamacare, costs have actually gone down, or the healthcare inflation has gone down to the slowest rate that we've seen in a long time.
For the very first time in their lives, these Americans will be able to provide health insurance for their families.
Half the uninsured in California are Latino, yet they account for just 21% of people who have signed up for new insurance plans.
We see that only 11% of the population is actually people that were formerly uninsured that are now insured.
This is so awesome that they have gone out of their way to insure my 14-year-old Yorkie.